Gentlemen and ladies, good day. Welcome to today's class. This focuses on prevention of preventive measures in heart disease, and we are looking at the role of the pharmacist in preventing heart disease in those who already have complications and those who have not yet experienced the complications. So we are talking about primary and secondary prevention. We will cover the definitions of what cardiovascular disease is. We will look at the primary and secondary preventive measures. We'll look at the symptoms and the subtypes of coronary heart disease. And then we'll look at what are the risk factors that we need to address in the prevention of heart disease. It is crucial to understand cardiovascular disease, and in this slide, we are looking at coronary heart disease, we are looking at heart attacks, we are looking at arrhythmias, we are looking at heart failure. With coronary heart disease, we are looking at a condition, a disease where the heart arteries that supply blood, oxygenated blood, to the myocardium gets blocked or narrowed, leading to reduced perfusion of the myocardium. And this may lead to a heart attack where the blood flow is sufficiently blocked, and this may lead to damage to the contracting muscle. Or the contracting muscle, when it is sufficiently damaged, it may actually present problems in terms of affecting the conducting tissue, leading to arrhythmias, where we have abnormal irregular heartbeats, which may lead to complications in the function of the heart itself. Eventually, we may end up with a problem where the heart eventually fails to effectively supply sufficient oxygen and supply blood to support physiologic function, what we call heart failure. What are the issues relating to asymptomatic nature of cardiovascular disease is that naturally most people may actually not show the symptoms. So many individuals do not show the symptoms until an incident which implicates complications actually begin to occur. And this then implies that it is important that screening is done and we anticipate the challenges that may lead to cardiovascular disease and proactively devise interventions that may actually address these issues. What are the events that may lead to cardiovascular disease manifestations is that, there is a slow development of cardiovascular disease, and sometimes because of this, patients may often fail to identify the problems that may actually be undergoing, may actually be affecting the heart. And because of this, healthcare workers, including pharmacists who come in close contact with patients, will need to assess the risks and identify those risks such as blood pressure, high cholesterol levels, including sedentary lifestyles that may actually mitigate cardiovascular risk. And what may need to be done likely is to develop steps that may need to be done to reduce the development of cardiovascular disease. And in approaching prevention of cardiovascular disease, we may need to look at what are the primary preventive measures and also what are the secondary preventive measures. The primary preventive measures focuses on preventing the occurrence of complications of heart disease, and also this is different from secondary preventive measures, which focuses on how do we prevent further complication for the disease where we already have complications and symptoms of cardiovascular disease exhibiting. So how do we prevent primarily the occurrence of heart disease is to ensure that pharmacists review patients' medication and identify potential risks and interactions that could affect the heart. We have learned, or you have learned in your pharmacology as well as other courses, on how interactions or even just medications can actually predispose to heart disease. Lifestyle evaluations also needs to be done, focusing on how do we modify the lifestyle of our patients by encouraging health living in terms of their diet, in terms of exercise, to manage their weight and improve their body mass index. So how do we do this is to ensure that patients or our clients um, screen against excessive weight, also screen for high blood pressure, and also screen for high cholesterol levels. Preventive treatment strategies will be lifestyle changes, vaccinations for various conditions, and also medication management. How can we assist those who are at very high risk for these cardiovascular diseases, especially the aged, those who are diabetic, and those with high blood pressure, is to understand the hidden risks and also help um, these individuals without symptoms that they can still harbor risks. So we have to encourage them that even if they are not showing symptoms, they are capable of actually harboring risk that they may actually complicate into cardiovascular disease. So patient education is very, very important. So the pharmacist will have to educate the patients and guide them towards preventive measures. Also important is to promote preventive measures by guiding on lifestyle changes and strategies that may prevent significant risk to heart disease. The secondary measures, again, here we are saying this, the patients are already showing symptoms of heart disease. So how do we help them? Is that the pharmacist should be able to help in managing the medication regimen so that the patients are actually adherent to medication, so that their blood pressure is controlled, their weight is managed, their lifestyle also is in tandem with their condition. Lifestyle modification we have talked about, and also monitoring outcomes. Importance also, ongoing disease management, help the patients ensure that the heart disease is managed by providing medication and also linking them to access in terms of where they can't find the medication. We make sure that they find the medication, and also we help to make the follow-ups.